Welcome to BLR's audio training program. You can navigate through the program by using the menu on the left to select particular screens. To view the script for each slide, use the Script tab next to the menu. In addition, you can search for a word or phrase in the program using the search bar, located below the menu. Some course functionality may not be operational on some mobile devices or in certain browsers or operating systems. Please see our complete operating specifications for full details. And be sure to ask your supervisor or trainer if you do not understand any of the information presented in the program. Today, we're going to talk about working safely outdoors. Working outdoors exposes you to many different types of hazards, including poisonous plants, insect bites and stings, snake bites, other animal bites or scratches, heat and cold-related illness, pesticides and herbicides, and the hazards of any outdoor power tools you might use. To keep safe when working outdoors, you have to be aware of all the hazards and the precautions you need to take to prevent injuries or illness. The main objective of this session is to provide you with the information you need to work safely outdoors. By the time the session is over, you should be able to identify outdoor hazards, take proper precautions to prevent injury or illness, and apply effective first aid in the event of an injury or exposure. Let's begin the session with a little quiz to see how much you already know about working safely outdoors. Read each of the statements on the screen and decide if it's true or false. True or false? A variety of outdoor hazards can cause injury or illness. This is true. True or false? There's little you can do to protect yourself from outdoor hazards. False. True or false? It's safe to approach wild animals if they appear harmless. Also false. True or false? Pesticides can be hazardous to your health. This is true. How did you do? Did you get all the answers right? If not, you'll learn about these points and a lot more during the session. Let's continue now and talk about a common outdoor hazard that affects a lot of people: poisonous plants.
Have you or someone you know ever had poison ivy? If so, you know that it's definitely something to be avoided. Poison ivy, poison oak, and poison sumac are found virtually everywhere. Adverse reactions to these poisonous plants are the most common allergy in the country, affecting half of the U.S. population. It's the sticky sap called urushiol from these plants that causes the allergic reaction. So if you get the sap on your clothes and then touch your clothes, you'll probably have a reaction. And if you have the sap on your hands and touch other parts of your body, you can spread the rash. Finally, if you're allergic and you touch these plants, you're likely to develop a very itchy rash about 2 to 3 days after exposure. The rash may swell, get bumpy, blister, and possibly ooze or scab. All these plants and their leaves should not be burned because their toxins can be vaporized and inhaled. You can't see the sap, and it only takes 1/billionth of a gram to cause an allergic reaction. What's more, urushiol can stay active on any surface you touch for up to 5 years. Because these plants are so common and the allergic reaction is so unpleasant, it's important to know what they look like so you can stay away from them. Remember the warning, leaves of 3, let them be. Poison ivy may look like a bush or a vine. Its compound leaf structure consists of 3 glossy pointed leaves. The middle leaf has a much longer stalk than the 2 side leaves. Leaf edges may be smooth or toothed. Leaves vary in size and length. Leaves are reddish-brown when they emerge in spring, turn green during the summer, and become various shades of yellow, orange, and red in the fall. Some greenish flowers grow in bunches attached to the main stem. Poisonous berry-like clusters form late in the growing season. Poison ivy can be found all over the United States. Poison oak looks a lot like poison ivy, but it grows primarily in the Pacific Northwest. However, poison sumac is different. It often grows in swampy areas and has oval leaves and drooping green or white berries. Poison sumac grows in the eastern United States. To protect yourself from these plants, keep your skin covered when working outdoors. Wear a hat to protect your head. Wear a long-sleeved shirt to cover your arms and gloves to protect your hands. Also, wear long pants, not shorts, and be sure to wear socks to cover your ankles. It's a good idea to tuck pant legs into your socks for better protection. The eye should be protected from contact with soil, bacteria, fungi, and sharp projections. Finally, outdoor shoes that completely cover your feet are the safest footwear. If you're working in areas with a lot of poisonous plants, it's best to wear high work boots. Avoid sandals and other footwear that expose your bare feet anytime you're working or walking in an area where there might be growths of poisonous plants. First aid for contact or possible contact with poisonous plants includes 5 simple steps. Step 1. Wash thoroughly with soap and water when you finish an outdoor job. Be sure to use a basic or mild soap that does not further irritate the skin. Step 2. If you know you've made contact with a poisonous plant, carefully remove your work clothes with gloves on and put clothes and gloves in a plastic bag for laundering. Then wash any skin areas that might have been exposed at least 3 times with soap and water. Step 3. After washing, cleanse the area with rubbing alcohol. Step 4. If you get an itchy rash, you may get some relief from aspirin, hydrocortisone cream, or antihistamines. Calamine lotion may also provide some relief, but it can also spread the problem, so be careful. If you are highly allergic, see your doctor who can prescribe medication. Step 5. Try not to scratch. It's almost impossible not to, but try anyway. Scratching slows healing and can spread the rash.
Another hazard when working outdoors is encountering bees, wasps, and other insects that sting or bite. You may not feel the sting or bite when it happens, but you will probably notice swelling, redness, itching, and even pain a little later. Some people have more intense allergic reactions to insect bites or stings. These reactions could result in hives, dizziness, stomach cramps, or nausea. In rare cases, people suffer severe reactions such as weakness, trouble breathing, trouble swallowing, unconsciousness, or shock. Severe reactions can be fatal. Call 911. Someone suffering a severe reaction needs immediate medical attention. If you have a known allergy to bites or stings, be sure to carry an EpiPen or antihistamine to counteract an allergic reaction. Spider bites are generally harmless. Only about 10% of spider bites have serious consequences. The bite of the black widow spider is an exception. If you're bitten by a black widow, you could experience bad stomach pain and cramps, difficulty breathing, and possible nausea, sweating, twitching, shaking, and tingling in the hands. Black widows are small, less than a ½ inch in diameter, and have a red hourglass mark on the underside of the abdomen. They live in woodpiles, sheds, and basements. The brown recluse is another dangerous spider. They're even smaller than black widows and have a white pattern on their backs that look like a violin. Their bites can cause some of the same reactions as black widow bites, but they're not quite as dangerous. Seek immediate medical attention for black widow or brown recluse spider bites. Now, let's look at some do's and don'ts for preventing insect and spider bites and stings. First, the do's. Wear long sleeves, long pants, socks, gloves, and outdoor shoes to cover your skin. Wear white or light colors, which helps reduce the number of insects and spiders you attract. And use insect repellent. Now for the don'ts. Don't wear perfume or cologne, which attracts insects. Don't swat at insects, since this might actually attract them. And finally, don't do outdoor work if you're severely allergic to insect or spider bites and stings. Think about the steps you take to avoid insect and spider bites and stings. Are they effective? Most insect bites and stings are just uncomfortable but not dangerous, as we've said. so first aid is pretty simple. Apply ice to relieve the swelling. Use calamine lotion or hydrocortisone cream to relieve the itching. And try to remove the stinger. Use your finger or a credit card to flick the stinger out of your skin. Don't use tweezers because you could squeeze more venom into your skin. If you're allergic to insect bites and stings, especially if you're severely allergic, first aid is critical, so you have to be prepared. Carry an allergy kit prescribed by your doctor and learn how to use it. Also, train friends and family to help you use it. Keep your kit near you at all times when you're outdoors around insects. Wear a medical identification tag that will inform others of your allergy. You might also want to discuss allergy shots with your doctor. Treatment with allergy shots may be appropriate and help control or prevent a severe allergic reaction.
Lyme disease is a bacterial infection caused by the bite of a tick. The infection attacks a number of the body's organ systems and can be serious if not treated early. The human body doesn't maintain a natural immune system to Lyme disease, so you can be reinfected if you're bitten again. Ticks are generally picked up when your clothes or hair brush against a leaf or grass or other object the tick is on. Ticks are generally found within 3 feet of the ground. Once picked up, a tick will crawl until it finds a place to feed. Common feeding areas include the back of the knees, near the hairline, or behind the ears. Only certain ticks transmit Lyme disease. In most of the country, they're called deer ticks. In the West, they're called black-legged ticks. Signs of infection often begin with flu-like symptoms, including headache, stiff neck, fever, muscle aches, and fatigue. About 60% of those infected notice a unique enlarging rash, which sometimes resembles a bruise at the site of the bite. Some people don't notice any early symptoms. And treatment for Lyme disease depends on how early the diagnosis is made. Antibiotics are usually prescribed and are generally effective when the infection is caught in the early stages. The best response to Lyme disease, of course, is to prevent it. This simple checklist will help. When possible, avoid tick-infested areas such as woods, grasslands, and dunes during tick season. If you go into these areas, stay to the center of the path. Wear long sleeves and long pants. Tuck your shirt into your pants. Also, wear socks and tuck your pant legs into them. This keeps ticks on the outside of your clothing where you can see them. Wearing light-colored clothing helps spot ticks more easily. Use tick repellent. Be sure to wash it off when no longer at risk. Perform frequent tick checks. If you feel something crawling on you, check right away. It could well be a tick. When you come inside, check all over your body. A tick could be anywhere. Finally, remove ticks properly. Use fine-point tweezers to grasp the tick at the place of attachment, as close to the skin as possible. Gently apply a firm, steady pressure until the tick releases. Don't jerk, twist, squash, or squeeze the tick. Wait for it to release. Clean the wound and tweezers with antiseptic. Burning the tick with a cigarette or using petroleum jelly or nail polish to smother it are not effective methods. Watch the site of the bite and your general health for symptoms, which usually take several weeks to develop.
Okay, now let's test your memory and your powers of observation. In the middle of the screen, you see a list of captions identifying outdoor hazards. To the right and left of the screen are pictures of those hazards. See if you can match the words to the pictures. Here are the correct answers. The bottom left image is of a tick. The bottom right image is of a black widow spider. The top right image is of a brown recluse spider. The top left image is of poison ivy. How did you do? Did you get them all right? Let's try another matching exercise. In this one, match the outdoor hazards listed on the left side of the screen to the appropriate first aid listed on the right side of the screen. Here are the answers. For contact with poison ivy, wash 3 times. For a black widow bite, get immediate medical attention. For an insect bite or sting, apply ice. And for a tick bite, remove with tweezers. How did you do? Did you get them all right? Now it's time to ask yourself if you understand the information presented so far. For example, do you understand what we've said about poisonous plant hazards, protection strategies, and first aid? Insect and spider bite and sting hazards, prevention and first aid. Lyme disease causes and prevention. It's important for you to understand all this information so that you can protect yourself effectively against these outdoor hazards. Let's continue now to the next slide and talk about snake bites.
The risks of being bitten by a venomous snake or any snake are surprisingly low. Fewer than 10,000 Americans are bitten by venomous snakes annually. Only a handful of people die from snake bites, and that's surprising because every state except Maine, Alaska, and Hawaii is home to at least one of 20 domestic venomous species. Reactions to venomous snake bites include pain, swelling, and bleeding. More complicated reactions include purple discoloration, tissue dying and turning black, low blood pressure, and tingling of the lips and tongue. Even a bite from a non-venomous snake can cause an infection, and some people may have an allergic reaction. Most venomous snakes in the United States are in the family of pit vipers, which includes rattlesnakes, copperheads, and water moccasins. Pit vipers are noted for their 2 fangs that deliver the venom. Coral snakes are another family of venomous snakes. They're found mostly in the southern states. They have small mouths and short teeth, so their bites are hard to detect. There are only a few dozen coral snake bites every year. Do you carry a snake bite kit in areas where venomous snakes are found? Here are some do's and don'ts to follow if you or someone you know is bitten by a snake. Do remain calm and restrict or limit movement as much as possible. Remove any rings, jewelry, or tight clothing around the area of the bite because the affected area may swell. If possible, keep the affected area below the level of the heart to reduce the flow of venom. Clean the wound, but do not flush it with water. Cover it with a clean, dry dressing. Seek medical attention immediately. Don't put ice or cold packs on a bite. Don't use a tourniquet. Don't drink caffeine or alcohol. Don't make cuts in the wound or try to capture the snake. Try to remember what it looked like instead. These actions can cause more harm. Any snake bite, even if you think it's from a non-venomous snake, should receive immediate medical attention just to be safe and prevent infection or an allergic reaction. Avoiding snake bites usually isn't hard. The most important rule is to leave snakes alone. Stay well clear. Snakes will only strike if threatened, so don't try to take a closer look or try to kill a snake. Give snakes plenty of room, at least 6 feet. Stay out of tall grass unless you're wearing high, thick leather boots. Remaining on hiking trails as much as possible will keep you and snakes apart. Watch out where you put your hands. Never stick your hands into areas you can't see. Don't reach into holes, under rocks, into piles of wood, or under logs unless you can clearly see the space. Finally, be alert when rock climbing. Snakes are often found in crevices and on ledges. Do you take these precautions when working in areas where venomous snakes are found? What other precautions do you take?
Other animals can be dangerous too. Animals will often bite if they feel threatened in some way. Bites and scratches from wild or domesticated animals can be hazardous in two ways. The first is infection. Untreated bites and scratches can become infected. Bites and scratches that break the skin are a particular concern. The main hazard of animal bites and scratches, however, is rabies. Rabies is a virus that is primarily transmitted through an infected animal's saliva. But scratches can be dangerous too. Wild animals such as skunks, raccoons, foxes, and bats may be infected with rabies. Domestic animals such as cats and dogs can also get rabies if they haven't been vaccinated. Fortunately, there is a very effective vaccine for humans that provides immunity to rabies when administered soon after a bite. Simple first aid applied immediately after an animal bite or scratch can prevent complications. The first step is to stop any bleeding. To do that, use a bandage or clean towel and apply pressure to the wound. Then wash the wound gently with soap and water under a running faucet for 5 minutes. Dry the wound and cover with a sterile dressing. Do not use tape or a butterfly bandage to close the wound, however, since this could trap harmful bacteria and promote infection. Call your doctor and explain what happened. Your doctor might recommend a visit to look at the wound. Your doctor will be able to tell you if further treatment, such as antibiotics, a tetanus booster, or a rabies shot, is required. Also, call your local animal warden or animal control officer. Describe the incident and where it occurred. It may be possible to capture the animal and have it tested for rabies. And if the animal is found and tests positive for rabies, or if the animal cannot be found, the doctor will likely recommend a series of rabies shots. The best thing, of course, is to avoid animal bites and scratches entirely. Here are 6 preventive strategies. 1. Keep well clear of wild animals and domesticated animals you don't know. 2. Don't get between two animals. For example, two dogs fighting. 3. Leave animals alone when they are eating. They might attack to defend their food. 4. If an animal approaches you in a threatening manner, back away slowly. Don't panic and run. Talk to the animal in a calm tone. If you are holding food, drop it. 5. If you think an animal is ready to bite or attack you, wrap your lower arm in a jacket, sweatshirt, or towel and hold it out in front of you to shield your body. And 6. Remember, an animal's instinct always is to protect their babies. Do not touch or go near animal babies, and never get between a mother and her babies. But if you follow number 1 and stay away, that's the best way to prevent an attack.
Now let's leave animals and move on to another outdoor hazard: heat. Heat illness includes a variety of ailments, from a simple heat rash to fainting, heat cramps, heat exhaustion, and the life-threatening heat stroke. Getting used to the heat is a critical factor in avoiding heat illness. It takes the body 5 to 7 days to get used to working in the heat. So when it gets hot outside, give yourself time to acclimate. Cooling is also important. That means taking breaks from time to time in a cool, shady place to give your body a chance to cool down. Using common sense and not overdoing it when it's very hot will also help you prevent heat illness. If you must do heavy work outside in the heat, try to do the most strenuous work early in the day before it gets too hot. When humidity is high, be sure to take more periodic rests and increase water intake. If humidity is high, perspiration evaporation is diminished and the body's cooling mechanism becomes ineffective. Wearing light clothing and a hat to protect your head, face, and neck can also provide some protection against the heat and sun. But perhaps the most important prevention strategy of all is drinking lots of fluids all day when you work in the heat. That means at least a glass of water every 20 to 30 minutes to replace fluids you lost through sweating and keep your body hydrated. Exposure to the cold can also cause health problems, specifically hypothermia and frostbite. Hypothermia is a progressive loss of body heat due to prolonged exposure to cold temperatures. Frostbite occurs when body tissue actually freezes. The most commonly affected parts are the fingers, toes, cheeks, nose, and ears. Hypothermia can be fatal, and frostbite can lead to amputations and, in severe cases, death. To protect yourself when working in the cold, dress warmly in layers. Change clothing if it gets wet. Wet clothes can increase the risk of hypothermia. Also, take frequent breaks inside or in a sheltered place to warm up. If you start to feel cold, are shivering uncontrollably, and your lips and fingers turn blue, you're experiencing symptoms of hypothermia. Get into a warm place immediately and wrap up in blankets or other warming material. Get medical attention if symptoms persist. If any areas of your skin become white and waxy looking, you may be suffering from frostbite. So get to a warm place immediately and cover the affected area with a blanket or other warming material. Don't rub or run under hot water. Get medical attention if the area does not return to normal within a short time. If you're working with pesticides and herbicides, remember that they are hazardous materials. Unless handled carefully, they can be hazardous to your health. Always read the label carefully and find out what the hazards are, what precautions you have to take to prevent health problems, and what to do in the event of an accidental exposure. If you're at work, also consult the Safety Data Sheet, or SDS, for the product. Basic first aid procedures for hazardous materials apply to pesticides and herbicides, too. First aid focuses on 3 kinds of exposure: inhaling vapors or dust, getting pesticides or herbicides on your skin, and accidentally swallowing these hazardous materials. Swallowing is the least likely, but it can happen if spray gets into your mouth or if liquids splash up into your face and get into your mouth. They can also be ingested by breathing through your mouth. Finally, for inhalation, get to fresh air immediately. For pesticides and herbicides on the skin, wash the area carefully for several minutes with soap and water. For splashes in the eye, flush the eye with clean water for at least 15 minutes. The safest route is to assume that all such exposures require medical attention after first aid has been applied.
Power tools such as chainsaws, lawnmowers, weed whackers, and other equipment can also be hazardous. Outdoor power tool hazards include cuts and amputations from sharp blades, eye injuries from flying particles, back injuries from lifting and maneuvering heavy equipment, and fires from gas used to fuel the power tools. If you use outdoor power tools, you should already know how hazardous they can be. You've probably heard stories about some terrible accidents. Maybe you even know somebody who was hurt. To protect against outdoor power tool hazards, be sure you know how to operate the equipment correctly and safely. Read the instruction manual and pay particular attention to safety warnings. Wear the personal protective equipment or PPE recommended in the instruction manual. For most outdoor power tools, eye protection, hearing protection, foot protection, and gloves are recommended. Take precautions against back injuries by lifting equipment properly and maintaining a safe posture while using the tool. Avoid awkward postures that strain your back. Focus on what you're doing while working and avoid distractions. A moment's inattention could cost you a serious injury. Avoid wearing loose clothing that can become tangled in moving parts. And finally, always be careful when using and storing gasoline. Gasoline vapors are highly flammable, and even a spark could ignite a fire. Do you always take these precautions? What other precautions do you take when working with outdoor power tools to prevent accidents? It's time for a quiz to see how much you remember about outdoor safety. Read each statement on the screen and decide on the best answer to complete the sentence. If you see a snake, you should A. Try to kill it, or B. Stay 6 feet away. The correct answer is B. Stay well clear of snakes, even if you don't think they're poisonous. If you leave them alone, they'll leave you alone. Wild animal bites are A. Not dangerous, or B, could be dangerous. The correct answer is B. Wild animal bites and scratches can get infected, and if you're bitten by an animal infected with rabies, you could get rabies unless you get vaccinated soon after the bite. Most pesticides are classified as A, hazardous, or B, not hazardous. The correct answer is A. Most pesticides and herbicides are hazardous chemicals and should be handled the same way you handle any other potentially deadly chemical. Exposure to some pesticides can make you very sick. When using outdoor power tools, you A, need PPE, or B, don't need PPE. The correct answer is A. When using outdoor power tools, always wear appropriate PPE, such as eye protection, hearing protection, foot protection, and gloves. How did you do? Did you get them all right?
Now let's quickly review to make sure you understand all of the information presented in the previous slides. Do you understand what we've discussed about snakebite hazards, first aid, and prevention? Other animal bite hazards, first aid, and prevention? Preventing heat and cold illness? Working safely with pesticides and herbicides? Working safely with outdoor power tools? All of this information will help you protect your safety and health when working outdoors. Let's continue to the next slide now and conclude the session with some key points to remember. Here are the main points to remember from this session on working safely outdoors. Recognize poisonous plants and take steps to avoid them. Protect yourself from insect bites and stings. Avoid snakes and other wild animals. Take proper precautions when working in the heat or cold. Be careful when using pesticides and herbicides, and remember that they are hazardous substances. Understand outdoor power tool hazards and precautions. This concludes the Working Safely Outdoors training session. Please be sure to go back and review any information that is not completely clear using the back or rewind buttons below. If you still have questions, be sure to see your supervisor or trainer.